What's up, everybody? Lauren here. This is like my second or first YouTube video. Anyways, I am getting my fillers done today. We are getting fillers with my girl, DR.Lanna. She asked me to come down and be one of the models on stage, and we're gonna be injecting my face. But fillers are a great way to do a non-invasive surgery. So it gives you a refreshed look, because hello, I'm Dominican, and you know, I'm trying to look good when I get older. Feel me? Anyways, follow me along. We'll have some snippets and we'll be on stage getting our fillers done. Thinking about my lips. I'm thinking about getting them done, but my lips are natural and I don't know if I want that. Anywho, I'll be right back, okay?
So this is an assessment technology. It's called Alma IQ.
Alma IQ.
So what it does, I'll actually show you from here.
On this one.
The guts.
So I have to put my face in there.
So the patient will put their face, rest your chin centered here. We're gonna do it in this one.
Oh,
I
okay.
just want to show you the inside of what you're up for.
Okay.
There's no pain, there's no discomfort. It's just like 45 seconds to a minute. And these are LED panels with 10 different light modalities. So you get to see texture, pigmentation, vascularity, symmetry, balance, all that kind of stuff. So let's.
Is this like a before and after of fillers or no?
That's a great question. So it will save the images in a cloud.
Okay.
And the clinic, the practitioner, will be able to use those as reference points. You can do baseline.
Oh, that's awesome.
After you've had your injectables, your filler, or a resurfacing procedure
I get to look back at the before.
If they're saying, oh, I'm not, oh wow, this looks amazing. Okay, here are your success results. Or if they're not quite certain yet, they're not convinced that they've actually seen a result, you have the visual receipts. So you can really track real time from a clinical perspective, the larger story.
Alma is a new app.
Alma is the name of the company. It actually means soul. And Alma IQ.
Oh, in Spanish. Alma, el alma.
Yes.
El alma, okay.
And then Alma IQ, it references the intelligence behind the clinical assessment and being able to broaden the conversation about what's happening in the clinic.
Okay.
Yeah, chin there. I know. Hair's gonna go in. So ideally, what is your name?
Lauren.
Hi, Lauren. I'm Kevin. Do you see the little horizontal light bulb? So if someone is dealing with...
Who is this white woman?
Underlying...
Who is this Sammy supposed to look at?
Cousin once removed from that side of the family, you know.
This is pretty dope. And they get to show you like variations of what the skin looks like in different tones, right? It's pretty cool.
So texture, vascularity, hyperpigmentation, harmony and symmetry for building up cheeks, noses, lips.
So DR.Lanna, you gotta hook me up. Look at this. We gonna get rid of this cheek right here, wrinkle right here, right here. I'm ready to do the fat transfer. Oh. Come, I'll take some out your back. Come on. Yeah, I got you.
Need me on the camera?
What do you do?
I'm in sales.
You're in sales?
Yeah, I'm Jay.
Nice to meet you, Lauren.
Nice to meet you, Lauren. How you doing?
Can you tell us a little about today's event?
With Alma Lasers, we're here in New York City for the biggest aesthetic event of the year. Going over a ton of new stuff. We've got about 12 new devices out. We've got skincare. We've got home kits. You can't put this on camera. I'm freezing up.
No, go ahead. We'll cut it up. Trust me.
Okay.
Are you into? You're in the beauty industry.
Yes.
Are you into fillers?
As far as the company is concerned?
No, like you yourself personally.
No, I do Botox here and there.
Botox here and there. But what age do you think men, because you know how women, we get it a lot, but what age do you think men should be getting Botox?
I mean, it's preventative too, so you could start, and I've got a friend who's 32, he's doing it, you know, so I think...
How long does it usually last?
4 to 6 months.
4 to 6 months.
Yeah. Do you do it?
Me? No, I haven't gotten it yet.
Okay.
They put you to sleep and they put this under your skin and then they suck the fat. This is amazing. I need one of these. Can I get this in a small?
Hi everyone, my name is Christina. I'm a nurse practitioner. I am co-owner of DR.Lanna Aesthetics in Staten Island and New Jersey. We are here today at the Alma conference in New York City with our beautiful model. Today we are doing full face rejuvenation. We're going to do a liquid facelift combined with a PDO thread lift.
Oh, wait.
This is absolutely amazing. She's going to look snatched, rejuvenated, fresh, and absolutely natural.
No, wait. Tell us about what exactly is the facelift, because a lot of people, they're scared.
Yes.
With fillers.
So people hear liquid facelift, they hear fillers, people get nervous. Do not be scared of fillers, okay? Be scared of injectors that don't know where to properly place the filler. So what we like to do is pan-facial rejuvenation. What is that? That's global rejuvenation of the face, balancing the features, okay? There's a rule of thirds within the face where every ounce of your face needs to be balanced. So that way from the side profile you have a full visual balance of your features as well as rejuvenation. Now filler is hyaluronic acid and lidocaine. We naturally have hyaluronic acid in our body. This is synthetically made in the lab. It lasts about 6 to 12 months depending on your face. We place it strategically so that way you can get a beautiful lifting effect without looking overly done. I think that's the number one thing, is finding an injector that knows how to inject properly and perform global rejuvenation.
Now, how would someone know if they need it? Like, what age should I be getting it, or how would I say, okay, well, I need fillers in my face?
Yes, so I would honestly say age does not matter, but typically above 20 is when we start volumizing. After 25 and 30, you start to lose collagen and elastin gradually each year. The fat pads in our face start to droop down and forward. So when you have a volume deficit in these areas, then you need that rejuvenation. So I would say take a look at your face, see if you're losing weight, if you're losing collagen, if you're losing elastin, it's time for volume replenishment.
Now, how soon would I start seeing results?
Oh, you'll see results immediately.
So as soon as I get them injected?
Yep, as soon as you inject filler, you see the results. With the PDO thread lift, you see the results immediately, but the results get better over time. Once the thread dissolves, 6 months later, you build collagen in that area.
You know what that means? That means save your money and come see my girl, DR.Lanna and Christina.
Yes.
Have them hook you up.
Let's go.
Tell them you came by me, you know? Get that little discount.
Yes. Mention her name.
Great. This is great.
Local, cycle studio, things that they then share on their page that you tag them or you let it go.
Good. It's from Alma. What is it? It's pretty cool. Oh, wait. Oh.
You're like a kid in a toy store.
Listen. I'll tell you something about this skin beauty right here. It's not bad.
And then we're going to do speed dating.
There is some fine people here. Very good looking people here.
Yes, I mean, it's an aesthetics conference. Everybody better look good.
And I'm the only Dominican up in here, you know what I'm saying?
A little spice.
When I first came to the office, you guys were in 70 and Park. You still didn't have no offices yet.
Yeah, really?
And then in the course of everything that has transpired, you guys have like four offices. DR.Lanna's amazing.
We have a whole entourage, whole team.
I don't know, just put me in the back. Let me inject people or something. I don't know. Let me do the butt stuff. I was practicing in this.
You know what we'll do when we go to the Dominican Republic?
We'll do
pop-up. There you go. You're certified in the Dominican Republic. There you go. We're set. It's certified to inject DR.
Like, you know, I can translate, right? Like, I can translate, yo, aquí, right here, ¿sabe? Aquí, acuérdate aquí.
You need a little bit of this, a little bit of this, a little bit of this.
And this is growing. This is ever growing. Hello, how you doing? Nice to meet you, Loren.
Francisco.
When I'm going to have you come out when I finish my talk.
Okay, cool.
And Christina's going to start talking about the
Oh, he's Puerto Rican?
Okay. That's right. That's my girl. That's my girl. That's right.
Cosmetics Insider. Please get loud. Please get rowdy and welcome to the stage for the first time this weekend, DR.Lanna.
That's right. Me. That's right.
So entrepreneurship
is something that we never think we're good at. It's kind of like having a business is kind of like being a parent, right?
Sure is.
It's like you're never ready. You can read all the books, you can get all the advice in the world, but you're never ready to actually own a business until you just go and do it. And so today, because this is the Business of Beauty Conference at Alma, with great visionaries, people that move the needle, movers and shakers in this room.
Yes!
We are going to be talking about how to build your business.
So we have to perform this rejuvenation. We like to also utilize PDO threads in a reverse vector. Now, why have we been using reverse vector more than anything? Well, you have to be smart about what you're doing within your practice, right? So if you do multiple treatments on the same day, I would say I'm a little bit more aggressive than other people within our practice.
And so one thing that I always like to do is I have the patients take a look in the mirror, but of course, we can't use the mirror today because
I trust you.
Yeah, she trusts me.
I trust
She's fun. All right, so we've done a little bit on her like a year ago. Snatched, right? That's what you said.
You know it.
Snatched. So what we're gonna do is assess for the skin quality. We're gonna do some reverse vector threads on her, and look what happens. It's not just the lateral eye and the upper face, but it's also helping with the nasolabial folds. It's also helping to hammock that under-eye tear trough, so that when I go ahead and do tear troughs, probably not today, but in the future, what she's gonna see is that we're gonna need less, so that everything looks a little bit more snatched. And then that's also going to lift the lower face. And so I always talk about the platysmal bands and the platysma and the SMAS kind of like playing a tug of war with your face. We are trying to lift her up, and then everything is pulling her down. So we do have to address the lower face as well. Sometimes we can just do Botox in the platysmal bands, in the Nefertiti neck lift, and other times we do use threads in the lower face. So go ahead and get started.
I'm going to start off by marking off the patient for the reverse vector thread. So I'm using the level lock threads. This is an 18 gauge 100 millimeter thread. It is a resorbable suture. I will place it into the area, lock it into place behind the line of ligaments, and then it's going to dissolve in 6 months. It's biodegradable. It's made of like similar to a Vicryl suture. It just dissolves over time, and then it builds collagen in place. Okay? It breaks down via hydrolysis. So I like to draw the lateral canthal area out. And then I assess the patient to see which would be the best area to perform this vector. And at the same time, I have to keep in mind that DR.Lanna will go a little bit more anterior than I am to perform her liquid facelift. So I'm going to go right here. So this will be my vector right in here. Okay. Perfect.
And so what she's trying to do too is that we always, anytime we enter into an area, whether it's with a cannula or whether it's threads, we always want to make sure we don't feel any pulsation.
Okay, perfect.
Then we do a little lighter with epinephrine. 2% lighter with epi.
Pinch, 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 pinch,
Small little amount.
Small little 0.1 bleb.
Just take your other hand off. And so what I'm going to do is I'm going to actually, is it okay if I have her turn slightly to this side so everyone can see a little bit more? Okay, perfect. Okay.
Whatever works best for you.
Let me help you.
Okay, no worries. Okay. So I'm going to use an 18 gauge needle. I'm going to create the entry point. So keep in mind, so now that she's turned a little bit, I'm going to have to reposition my body, but can you see? Yes? Okay. Pinch, 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 pinch. Can they see?
No. I think this hand's
No?
right.
Okay.
There we go.
I didn't feel nothing.
Okay. So now this is the 18 gauge. You can see it's an L-shaped cannula. It's blunt.
Pull back a little more in front of the camera. There we go. Okay, good.
Okay. Just let me know if you can't see, okay? So she's gonna feel, yeah, that's okay, don't worry. It's a little bit spicy. You go in at a 90-degree angle. Just wanna make sure that you guys can see.
Yeah, they're good.
Okay, 90-degree angle. Pinch, 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 pinch. before you open it. Feeling okay? Okay. Can you guys see?
Yeah, she pops it, and she drops it, and then she'll lock it.
Yep, I'm going to drop in at 70 degrees. Then I'm going to go up. So her artery's below where I'm at. There you go. So she feels some resistance. Then you apply some pressure, twist, come on out. And then I'll lock it into place. I prefer to use my hands more than the hemostat, to be honest with you.
Because you have more control.
Yes. All right, perfect. I'm going to put in one more low and then you'll be set. How are you doing, love?
Good.
Am I looking snatched?
Yes. Okay. So I'm going to go right behind that one. 90 degrees in. Ooh. Pinch, 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 pinch. Drop down 70 degrees. Pinch, 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 pinch. Pinch, 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 pinch. Take a deep breath. Can you see? No. Ready, love? Last one, babe. You're doing great. Too uncomfortable? There we go.
Perfect.
There you go. This one's a little bit spicy because they are 18 gauges, but once they're locked into place, you're all set. Look at how her under eye improved. Lo, can you take a look up front? Look at her under eye. So now when you perform the celebrity liquid facelift, you will use less product, saving your patient money.
Perfect.
You did great.
Okay, so now what I'm going to do you want to...
Yep, let me snip this.
I know we only have 10 more minutes, so we'll do one side and then keep you guys on track. Sound good?
Yep.
All right, so maybe with the camera, if we can just pull back a little bit. That way you can see how her whole entire side is now lifted. Right, you guys see it's a little thinner, slimmer. Her jawline on that side's a little higher. She looks just a little bit more slim, right? Okay, so now, what is that? All right. So what I'm going to do is I'm going to show you guys how I do on this side. You went in here. This is my contour. Contour is great. Contour has a good G prime, but it also has good flexibility. I find her temporal notch right here, and then I go in one area, which is going to be right here, which allows me to get the entire temple area, but also, should I need to, I can come down and give her a little bit of that cheek lift, and then if I need to do a little bit of that submalar or the preauricular space, I go in with this one down here as well. So this is a 25 gauge 50 millimeter cannula from Facelift store. Okay, so again, I'm going to give her, I'm going to keep my pinch and pinch. Burning, 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 my love. Good. Do you have a little vibration tool for her? So just 0.1 or 0.2 cc's is enough of Lido with the FE.
This is my favorite.
Okay, stay like that, my love. Okay, 1, 2, 3. Do you feel anything sharp? I always test. Little pinch. Okay, I go in there very quickly. So the space that you want to be here, I'm actually going to show everybody a little bit more. I see where her artery is. If you guys do not feel the artery, then maybe don't do it or use an ultrasound. We also do a lot of ultrasound as well, and we're probably going to start up some training with ultrasound. So what you want to do is you want to get into that nice plane. And she's had procedures before, that's why. And you want to be able to glide in that interfascial plane. I'm all the way up there right now. And actually you can, I don't know if you guys can see, but her artery is right here, pulsating. So what I like to do, I'm going to stay a little bit further down on that artery, below that artery I should say. And I'm going to start to inject my syringe. And then the most important thing is you got to be able to come out enough so that you can redirect your cannula. Pinch, 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 pinch. So you guys see I'm all the way up here now, aspirating, because I'm right near the artery. Right, your STA is there, superficial temporal artery. You have a frontal and temporal branch. And the whole time, I'm just going slow, injecting. And then remember, don't forget lateral to the brow. This is very, very spicy here because you have a nerve here. But I like to get this as well because this will also give you a little bit of that temporal lift as well. All right, so again, I probably do about 0.2 there. Now I'm going to go posterior. Get the cannula out as much as you can. Feel that pop outside the dermis. And then you're going to come back up here and then do the same thing in this region here to give her a little bit more of that temporal lift. And then I'm going to show you something really quickly. I just turn my cannula around, if you guys can see, and then I'm just going to go straight down. You guys see where I am? All right, so in this area with the cannula, I'm more superficial. I'm in the subdermal space, right? But I am going to also go deep to SMAS on bone, and I'm going to give her a little bit of lift on bone too. But if you have someone who's a little bit thinner who can really benefit from that nice dome-like soft appearance of the cheek, of the zygoma, this is what I love to do. And then I'm going to show you something really quick, is that I'm actually going to get in certain people that want a little bit more volume. You know, sometimes we have patients that need to be a little softer. I come all the way down into the submalar space and give her a little bit of lift there. And then I can actually do most of my injection, pinchy pinchy, all the way down here, okay? And then I can also turn it around and do in her preauricular area. But what I'm going to show you next, I'm going to stop before I come on out. Go ahead and put me 27 needle. Why do I stop before I come on out, you guys? Because if you get into a vessel with your 18 gauge, you don't want to inject on your way out because you can get into a vascular occlusion if you nicked an artery on your way in. That's why at least a centimeter before I come out, I stop. Also, you don't want a huge ball in the entry area, right? And so that's why it's so important for you guys to understand the anatomy, because everything travels through the path of least resistance. If you get into a vessel and then you go past that vessel, as you're extruding your needle or your cannula, it's going to come right back up in the cannula. And remember, your lateral zygoma is a very thin space. So if you're going to put 0.2 cc's in the lateral zygoma, most of that's going to come right back out at you. And you don't want granulomas, you don't want anything like that. So go ahead and just chin down slightly, my love. All right, so one thing that I'm going to do here, in order to keep that nice lift from the reverse vector, I'm going to go down here because remember, my thread lift is not here. It's posterior in the outer 1/3 of your face, which is immobile. So therefore, what I'm going to do, I'm just going to clean her up really well. I'm actually going to give her a couple of on bone, pinch, 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 pinch. Good, right on bone, and just give her a couple of 0.1, 0.05. And that's going to now secure everything in place so that your thread lifts are going to last longer. Because one of the things that you guys will hear and see is that people are going to say, well, doc, pinch, 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 I'll aspirate, but I know contour doesn't aspirate easily like lift does. Doc, the people are going to say, doc, you know, I didn't really get that much longevity from my thread. So here's one way of getting more longevity is because you're securing the tissues in that lifted space in order to get you that nice lift. So a couple of 0.1, 0.2 up here is going to give her that nice lift. And again, if you want that brow to be a little bit lifted, feel free to Botox them on the same day or even Botox them prior, because the more Botox they have in their face, the less likely they're going to have to move. And the less likely that they move their orbicularis, the more longevity and the better results you're going to get with your thread lift, especially for upper face. All right, so now, let me see, how does it look? So I do a lot of like kind of looking back and forth. Let me go ahead and turn towards me, my love. All right. I'm going to clean her off. Okay, go ahead and relax one more time. I know we're running out of time, but I'm going to do one more up here. 1, 2, 3, pinch, pinch, pinch. There you go. Right on bone. Now remember, as you get older, your zygoma kind of starts falling down a little bit and becomes thinner. So make sure you're always on zygoma. And again, zygomatical facial, you got to be careful of that foramen. Now I'm pretty lateral, and of course I don't want to hit below my zygoma, because what artery is below? Your transverse facial, right? And so when we look at our tear troughs, you have your ORL and your ZCL, right? Zygomatical cutaneous ligament, your orbicularis retaining ligament, right? everything is now lifted. It's like we're using that zygomatic ligament in this area to lift with our PDO threads from PDO Max, but also with our contour or any other high G prime like lift. So Restylane Lift and Restylane Contour are my favorites. So now what I want to do is I want you to sit up for everybody, and I want you guys to kind of look straight ahead. I just want them to see the difference between one side and the next. Yeah, I don't know if it shows so much on screen, but if you guys want to come take a look afterwards, it's really quite amazing.
The snatched process is now complete. Have a nice round of applause for Lauren and Christina with the liquid facelift session. We are now going to take a lunch.
No, just soft, yes. Just a soft, gentle.
Yes, somebody pressed it really hard.
Or if they go get dental work done. That's why I like the reverse threads more than anything. Most of my clientele are very animated, individual. This is actually how we also do the Sculptra technique. Yes. And with the Galderma products.
This looks no, look at this.
Well, so the question is though, when was the last time you had it?
What we're offering is the same.
Other side.
And then I wanted to
Other side.
and I'm just going to set myself
Front.
Look at the chin. See how my face looks more ovally?
You already texted me.
But you see how this is lifted? This looks amazing. See how this is lifted?
Yeah.
They do an amazing job. You guys gotta come check out DR.Lanna. She's amazing. That's my girl.
Ya, bueno, mis hijos viven allí, porque mi ex esposa es dominicana. Te voy a dar los dos. Sí, yo hago liposucción.
So that is all for today. We got threads done, fillers, and chin as well. I won't lie to you guys, it does semi hurt, and I'm gonna say semi because she did numb me before she injected anything, but she said for 2 weeks I have to sleep up and not to the side, and then this actually lasts me from, was it 18 months? 18 months, right? The threads are up to 18 months. The fillers are 9 to 10 months, but it's gonna be a while. Like, I got that refreshed look. DR.Lanna is amazing. She has 4 offices and she's opening one in New Jersey, and I am so privileged, and I'm gonna say privileged. That's my girl. She is a business. I am privileged that she always thinks about me when it comes to the fillers. But if you're the type of person that you're looking for a pick-me-up, and like Christina told you before, once you hit that 20 years old and you lose a lot of weight and you want to keep yourself that youthful collagen going through your face, you get fillers. It's a great way, non-surgical, right, to get that boost. I never knew about fillers until somebody put me on. And I will say my face has changed. Zooming in. Y'all see this? Y'all see this? Anyway, follow me on Instagram at Thecreditassist. And if you want a consultation with me, of course, y'all know my number. Anyway, Lolo's out.